There are 5 main surprises that people initially experience when they're on Medicare. But the thing is, it's really important that you know about these important things before you ever join Medicare so that you can keep your coverage intact and also make your life a lot easier to get the most out of your Medicare benefits. So in this video, let's cover what these 5 things are so that you know what to be prepared for to, again, get the most out of your healthcare. I'm Emily with the Medicare Coach, an independent Medicare consultant, helping our clients easily navigate both the government rules of Medicare, but also the insurance company options to help you have the best health insurance possible while also protecting your retirement savings. I'm going to also share some details down below, some extra free things to make your life easier when it comes to Medicare. So let's hop into what are these 5 surprises that you should be aware of once you're on Medicare. The first one is, how do you pay your Part B premium? I know this sounds silly, but a lot of people aren't quite sure how this works. Again, when you're on Medicare, most of you will have Medicare Part B as in boy. And if you're already drawing Social Security, your Part B as in boy premium comes directly from your Social Security check, automatically. You don't do anything about it, which is great. But if you're not drawing Social Security, there can be some confusion as to how do you pay it. And the thing is, Medicare will send you a bill in the mail. They are usually quarterly bills, sometimes slightly more when you're first joining Medicare, but they're usually quarterly bills. And that way you can just pay those bills on a quarterly basis, or there's another way to pay them monthly if you prefer that. But my point is this. It is so important to pay your Medicare Part B premiums. If you don't pay those bills, your coverage can be canceled, which can mean 1, penalties, 2, not covered, and 3, you're not always allowed to just hop back into Medicare instantly. So please make sure that you're paying your Medicare Part B premiums, because not paying those can create an absolute mess and a headache for you. Number 2 thing is overall billing messes. Many times when you first join Medicare, your doctor will say, well, Medicare isn't going to pay it, or things of that nature. When you first join Medicare, there can be a lot of billing confusion. And what tends to happen is that Medicare oftentimes still thinks that you have your existing employer health insurance. So when your doctor bills Medicare, Medicare says, no, I'm not paying it. This person has an employer plan, they're going to pay it. Don't panic when you get that denied claim thing. You simply need to contact Medicare, say, Medicare, I no longer have my employer health insurance, you are primary. It's usually a 15-minute call if you know where to go. And then just simply have your medical provider rebill Medicare within the next 15 to 30 days, and it should all be sorted. So again, don't panic. There's oftentimes some billing confusion when you first join Medicare, which is why I want to give you the heads up before you ever join Medicare. The third thing is prior authorization requirements. Now, if you're on Medicare Advantage, there's a lot more prior authorization required than, say, if you're on original Medicare. If you're on Advantage, most things will have prior authorization. It's going to have to go through your primary care provider or someone to kind of give you that approval. If you're on original Medicare, we tend to only see this issue with certain prescription drugs. And so, yes, there are certain times where certain medications will require your doctor to submit extra paperwork to your Part D or even Advantage plan company to approve a medication to be covered. There's no need to panic. With our clients, we'll always tell you who requires prior authorizations. That way your doctor can start on it. Again, people can panic if you're not properly debriefed as to how your plan works. But again, it's good to be prepared about that to avoid surprises, but it's not a huge deal in most cases. Prior authorizations is a very normal thing that your doctor goes through, okay? Number 4, most people don't realize that you have a Medicare.gov account that can make your life so much easier. So as soon as you get your Medicare ID number, go ahead and set up your Medicare.gov account. So you can do this before you ever officially have your Medicare start. And inside of your Medicare.gov account, you can 1, print off a Medicare ID card if you never get it in the mail or if you happen to lose it. 2, you can see the status of your Part B premiums. And 3, you can also see all of your claims in there. And so your Medicare.gov account is a really great place to go to get clarity on your Medicare coverage, and equally as important, to avoid having to call Social Security or Medicare and wait in line. Also, the chat function inside of your Medicare.gov account can be really helpful for simple questions as well. So get your Medicare.gov account. It will just make using Medicare overall so much easier. My number 5 thing that people often do that can create a mess once you're on Medicare is stop paying your premiums. I mentioned this in step 1 around your Part B premiums, but most of you will also have either Advantage plans, Part D plans, or supplement plan premiums. It is so important that you pay those plans on a timely basis. Especially if your Medicare supplement plan is canceled, it is an absolute nightmare to get it back. And maybe you can't even get it back. So I don't think it's a bad practice to check every other month, every 3 months, make sure your bills are being paid, or even try to pay all those bills upfront on an annual basis. I'm working with a client right now who has a bill payer, and the bill payer forgot to pay their bills, and it's a nightmare. And so pay your premiums. I know it sounds simple, but pay your premiums. You could be in the best plan ever, but if you forget to pay your premiums, you've wiped out all of your hard work. So be thoughtful, be thorough, pay your premiums. Medicare can be great, but as you're hearing me say, it is not like your employer health insurance, so it does make some changes to get adjusted to it. So let me know your comments or your questions down below, and I look forward to helping you easily make your right Medicare decision.